Now we're just going to talk about placing the cuffs on the patient for the PVRs and the segmental pressures. Once that's set up, you can easily do all the segmental pressures down the leg, and then you can also go and do the PVRs as well. So what you're going to have is you're going to have 2 cuffs on the thigh, 2 cuffs on the lower leg. 12 centimeter, 12 centimeter, 10, and 10. That's usually the setup. And then on the arm, also a 10 centimeter cuff. Now if a patient has a large leg all the way down, you might use 12s all the way down, but typically it's 12, 12, 10, and 10. So to put the cuffs on the leg, what we're going to have the patient do is just bend their leg up gently like this for this kind of an angle, and you're going to want to be aware of the balloon here and the connection because it's hard and you don't want to put it on the bone like this. So we're going to just start with the calf one here, have it off to the side, and you don't want to wrap it and like pull it tight. You just want to have it gentle and follow all the way around like that. Now calves are usually pretty round, although patients have different sizes, and if it's a little smaller down here, the cuff may be a little looser here. That's going to definitely happen on the upper thigh because of the way the thighs are shaped. Down here now we're going to go to the ankle cuff, and again, do not put it on here because when you blow these cuffs up for the segmental pressures, it gets very tight and that's going to hurt their bones, so off to the side like this. Down here there's going to be a little bit of a space also in between the skin and the cuff as we get down here because again the leg is thicker up here and it's a little thinner down here, so in order to have the cuff on here evenly, there is going to be a little bit of space down here. For the upper thigh here, what we're going to do is take the cuff like this. I kind of pull it towards me and then kind of slide it up so it goes as high up as you can get it, like that, and then you again bring it around to the side. Keep it even, and again on most patients there's going to be a little bit of space here because the thigh is a little bigger here than it is here. And again off to the side with your connector. And then for the lower calf, or I'm sorry, the lower thigh, again you're going to have it off to the side so this isn't on any bone, and it's going to be not tight but just snug so that it's put evenly around the lower leg there. And then as the patient brings their leg down here, I'm going to hold this cuff kind of up because as they put their leg down, we don't want it to slide down over the knee. So now here's the knee. When it blows up, it's going to be okay because we don't want to have it on the knee. If for some reason it does get kind of low, you can always take the upper thigh cuff off and move this one up a little bit to do the lower thigh cuff for the pressures. If a patient has a really short leg, you may only be able to put one cuff on there. You do the first pressure as high up as you can, and then you move it down for the next pressure. And if you have a patient with a very, very large leg, there's sometimes extra long cuffs that are longer than what you have. These are 44 centimeters. There are ones that are even longer than that so that you can wrap around those patients who have extra large circumference of their thighs. And then we do the same thing on the other side. We bend this up. Again, we're going to apply them the same way. Off to the side. Especially on the upper thigh here, you want to make sure that you aren't, there's nothing that gets caught inside of the cuff between the thigh and the cuff itself, especially maybe for your male patients. Just be careful. You know, that's why we slide it up as high as we can there and kind of keep snug against the edge. And then again, same thing for the upper thigh here. Again with our connector off of any kind of bone off to the side. As I lay the patient's leg down, I hold it up a little bit so that this cuff doesn't slide down. And again, because of the shape of the leg, there is a little bit of a space in between here. Now for the upper arms, you're going to grab 10 centimeter cuffs and you're going to place those on there the same way. Of course, have them remove their shirt so you don't have any clothing in between there. But for demonstration purposes, basically this is what we do here. Now to connect these cuffs up, I'm going to connect both sides here. The red is the right, the yellow one is the left. The solid colored cord goes on the brachial area up here, and then you've got varying lengths of cord, blue, green, yellow, orange, and black. And they just go from the shortest to the longest down the leg here. So that's the first shortest one, and then the green. So we got blue, green, and then we're going to do yellow on the calf, orange on the ankle, and then let me just grab the metatarsal cuffs real quick. And the metatarsal cuffs we're going to put on just like we do the other cuffs, just gently right around the ball of the foot there, like that. And then this one as well. And then the longest one of these cords goes on to that one. And then to do the other side, we're going to do the same thing with that. The yellow one would go to the brachial. The blue one is going to go to the upper thigh. The green one, lower thigh. Then yellow. And then orange. And then the black one.